what was your experience? What is why did you decide to join a clinical trial?
Uh, I decided to join the clinical trial because I was on, I was ITICA for 15 years and then it stopped working. Then I went to Dr. Tox was the chemotherapy, and that worked for about 3 weeks, about three treatments, sorry, and then that stopped working. So I was led to Pluvicto because nothing else seemed to work at that time. Upon the Pluvicto radiation infusion, um, it worked for me. The only problem with the that I experienced was the fact of the dry mouth. Um, I couldn't sleep with my wife for about 4 or 5 days after treatment.
Mm.
Uh, and a little nausea and vomiting that came along with it. But for the most part, it worked well for the six treatment that I had. I was introduced to it by through Mass General, and at that particular time, there was only seven other people who had went through this trial, and I was eligible to get in, and I was thankful for that because at that particular time there was nothing else available at the time.
How long ago was that?
Uh, a year ago, I was about a year ago. Yes, yeah.
Okay. And then tell us, I mean, a little bit more about your experience. Is it where are you today?
Today I'm on what you call Jedvana, which is cabazitaxel. After my last treatment with the Pluvicto, my PSA started to rise again, and Mass General directed me to this Jedvana, which is also part of a clinical trial that was going on at the time. And right now, I've had 5 treatments with that, and it's working pretty well. Although my PSA right now is 208, it's been steady for that for the last 3 treatments. There have been some drying up of cells of cancer cells, but also at this particular time, I've seen more cancer in the river area, the
Okay.
T4, yeah, T6 and T12.
Mhm. So I want to stop here for just a quick question. So I want to give people a taste of what you're experiencing in the clinical trial that you're on. I wanted to jump to Mr. King. Um, Mr. King didn't use a combination clinical. He didn't use radioligand therapy. I think your clinical trial was more like an intensification. Can you tell us about, your story about how did you even find out about this clinical trial and where? Could you go into some information about that? I mean,
Absolutely. So I'll say hi to everybody. Um, I My clinical trial was the Panther clinical trial, and it's an interesting story. After sort of uh, exploring or having all the standard of care, my PSA continued to rise, and this was in 2019. I happened to independently register for the Fin National Conference in DC. And I also set up an appointment with Dr. Daniel George. I have a support group here in Atlanta. I'm in Atlanta, Georgia. I have a support group here that recommended Dr. George. So when I went to Finn in Washington in 2019, it just so happens that Dr. George was one of the speakers. So I was able to, number one, meet him in advance of the appointment, and then within a week, go to Durham and meet with him and discuss what my options were at that point. And I was still trying to decide what to do. And there were a couple clinical trials that he had going on, but he recommended Panther. Now, what Panther is, there are what I knew I wanted to do was some kind of combination therapy. And what Panther is combining abiraterone acetate plus prednisone and apalutamide uh, to see if that impacts uh, my PSA. And at that point, my PSA had started to rise. And you mentioned the term doubling. It was doubling at the time. So uh, it immediately kind of halted that, and my PSA started to fall. For about after 6 months, about 6 months, I added another therapy, an immunotherapy, Provenge, that was allowed in that particular clinical trial. Sometimes they're not, sometimes you have to just stick to what the primaries are. But in this case, I could add Provenge. And again, that was around 2019, 2020. And my PSA has been pretty much undetectable until this past until about a month ago. I had a little rise after that, but I'm doing great. And it's been again 0.01 for 5 years.
0.01 for 5 years. And it's interesting about this intensification clinical trial that you were in is that it hits different sites, right? Okay.
It,
Go ahead, sorry.
okay, so you helped me with this, uh, Dr. Crawford. So part of the thinking that I had, but in talking with folks of folks, my doctors, I got an understanding that cancer cells aren't homogeneous; they're heterogeneous, which means you have to attack it in a lot of different combinations. And so, uh, you mentioned intensification. I think all those kinds of things matter when you have cancer cells mutating. Um, and so I was open to two different drugs. I was open to immunotherapy. I was open to whatever treatment that could deal with the the diversity of cancer cells.
And so it was interesting, and so why this is very important, why this clinical trial is very interesting, is the fact that it hits on two areas that our speakers had just spoken about. One, they both had mentioned um, uh, abiraterone, and it blocks the CYP 17A1. Well, you don't need to know that, but it blocks this protein that plays a role in the synthesis of steroids or androgens outside the prostate, which was key. But the other one, the apalutamide, is blocks the receptor. So you had a one-two punch at different target sites, and and that's really amazing. And a lot of people don't know that. And could you tell us a little bit about that clinical trial? I mean, was it a fair clinical trial? Did you have enough blacks and enough whites that participated in the clinical trial? And
Yeah,
then was there a difference in the performance of how people of the patients that participated?
absolutely. So it was a 2-year trial, and there were 50 white participants, 43 black participants. So it was about equal. And what is, I say, kind of exciting, um, black participants, the black men who were in this particular clinical trial responded better to the drugs in the trial than white men. And when I say responded better, what I mean is PSAs dropped lower for black men than white men. There was a longer PSA response time, progression time uh, for black men. In other words, before the PSA started to rise, it was about 30 months for black men, about 15 months for white men. So there was a longer time um, in that regard. And then if you look, I think if it's fatalities, I don't remember the specifics, but African American men tended to do better in terms of death rates. I want to say twice as well. So um, that's something that sort of the takeaway is for this particular trial, this was a trial that Duke did that was Black men responded very well to. And then secondly, you came away feeling like Black men need to be more involved in clinical trials so that you can pick up some of these differences.
Mhm. So I know you do have to run, but could you, if you had the opportunity, what you do, to tell the audience and prostate cancer survivors why they should, with this Black, white, or Hispanic, doesn't matter, why should you participate in the clinical trials, especially Black men? What would you want them to know and what you want them to take away from your message?
Well, first of all, I learned a lot. I'm still learning a lot. There are a lot of things that uh, just in terms of the education I received from the clinical trial, being able to communicate better with what I'll call my health team, being able to converse more with other men about my experience, my journey. Um, I've already mentioned the great response I've had as a result of being in that particular clinical trial. And um, I think if you think about folks in the future, um, then the exploration of research via clinical trials can help others going forward.
Mhm.
But if African American men aren't involved, we're kind of cut out of the picture. So I think that's a takeaway from me too, that we need to be communicating to other men. And I'll just say this as an example. Sometimes we don't talk to each other. This maybe not necessarily just African American men, but just men in general. But at my church, I serve in the usher board at my church, and we have oh, 100 guys in the usher board. Well, prostate cancer came up just sort of as a side topic, and they asked how many people have been impacted, and almost everybody in the room raised their hand. But we didn't know that because we're not talking to each other about these kinds of things. So
Right.
I'll just mention that too.
Okay, so that's important. Talking to people is important. And then, did you find moving forward, you find the Find Your Trial tool, fintrials.com, very helpful when looking for available trials in your area?
Oh, absolutely. Finn has been fantastic. And again, I've been fortunate because, as I told you, I came up to the national meeting in DC. And from that point, I have been focused on looking at trials via Finn and keeping my sights on Finn's website. So, and I'll say this too, Finn has been great in communicating with me. So that outreach is another component that I'll just mention, which is much appreciated.
And so we wanted, you talked about that church partnership. We need to be down there. I don't know what relationship we have with your church, but
You have
we,
a great relationship with my church. My church is Cascade United Methodist Church, and Pastor Muriel is somebody who has participated with Finn. So again, another Finn is outreach to my church. So again, I give props to Finn for all it's doing, connecting in Atlanta, at least through my church and probably other churches there too, or here.
so Mr. Cain, um, thank you again for taking time out of your day. I mean, and the fact you brought up something about um, uh, uh, talking about talking about your experience to other men, and it takes a lot of courage to get out and talk to men that way. And so, again, thank you.
Yeah,
Uh,
Dr. Crawford,
yes, sir.
I hate to butt in, but thank you for giving me this chance. I just want to ask Arcane and also Mr. Womack another question. And I do remember being at your church, and we had a great long relationship with Cascade for a number of years. And we're looking forward to continuing that work. But how many years are you as a prostate cancer survivor?
Well, thank you for asking that question. I was diagnosed on January the 14th, 2015. I'm 10 years plus into it. 10 years, what, 9 months almost.
Mhm.
Okay,
Fantastic.
8 months. So, and yeah, I'll say this, that standard of care treatments um, were fine, but my PSA continued to fall, but then rise again. And so the clinical trials have been incredible in terms of the elongation of my good health. So I've been in it for 10 years. And
Yeah,
to be honest, I probably had prostate cancer before I was diagnosed in January of 2015.
absolutely. And I might say the fact that your PSA is now what, 0.01?
It's been undetectable for the last 5 years. And I had a little bit of I have a doctor, I have a local doctor here just quickly, and my PSA went to 0.3 the last time I was in to see
Okay.
him. That was a month ago. And he said, well, and I had gotten off of the drug that I was taking. We took a break. He said, well, we'll get back on it and see what happens. But he said it could just be, he said, you still have a prostate, right? So it can still express itself a little bit. But again, things have been pretty well.
Well, we have much more work to do together. And I want to ask Sherman, how many years prostate cancer survivor are you?
I'm 21 years
Amen.
as of this month, 21 years. Yes. Yeah.
21 years.
Yes. Yeah. I was
Okay.
on, I would like to say that I was on the apparatus for 15 years, and that was maintained for 15 years. So I was happy with that before my PSA started to go up again. But it's been 21 years for me, and I'm thankful. And the other thing I would like to say to you is talking to people. I agree to talk to people because I was in the same situation where no one said anything to me. I was in church, no one said anything about prostate cancer. And it kind of infuriated me that no one said anything. But I vowed after that there would never be another Father's Day to come around that I didn't talk to men about prostate cancer. And I vowed to do that, and I continue to do that today.
Thank you. Thank you. And Dr. Crawford, thank you for giving me this opportunity.
All
And
right.
I see that Mr. Christian is with us.
Yeah. Mr. Christian, sir. Now, Mr. Christian's story is a little bit different because there are always been clinical trials in the United States, but he wanted something that was more advanced. So he had to go to Europe to get a cutting edge treatment that's now in clinical trials today. So, Mr. Christian,
Yes.
tell us your story. Tell us, and I did see your lovely wife in the back helping you get your screen, your caregiver and support.
Absolutely.
Tell us your story. Tell us, well, especially that focal point where you were just almost at your wit's end and you're
Yeah.
just almost ready to give up.
Yes. Yes. Thank you. Thank you. Thank you. Well, my name is Chuck Christian, and before my cancer diagnosis, just to give you a little background, I grew up in Detroit on the East Side. I played basketball and football in high school. I also beat Magic Johnson when I was playing, so that was pretty cool. And I was an All-American in basketball, and I played football and basketball, and I got recruited to go to the University of Michigan, and I played football at Michigan for 4 years. While I was at Michigan, University of Michigan, not Michigan State, University of Michigan,
Wolverines.
the Wolverines, absolutely. I played there 4 years, and we won 3 Big Ten championships and a Rose Bowl. And then after college, I moved to Boston, and I've been in Boston ever since. And I joined men's leagues when I was playing. You know, at that point, I joined some men's leagues, and I was playing. I was scoring like 30 to 40 points every game, even in my 50s. And then at 57, I was MVP in an 18 and over league. I was the oldest guy in the league by 22 years. So that was, and then all of a sudden everything changed for me.
And what year was that it
That
changed?
was 2016 is when I was diagnosed with prostate cancer. What happened was I was getting up 8 to 10 times a night to go to the bathroom. So I was diagnosed with stage 4 prostate cancer with metastasis to the bones. I had over 220 tumors in my bones. And my
200.
doctor gave me 3 years to live. And he told me that, he said, Mr. Christian, get your affairs in order and you're done playing basketball. You'll never play again. And he talked me into chemotherapy. So I did do the chemotherapy and it almost killed me. And I vowed to never, ever, ever, ever do that again. And I could feel my body was suffocating from the inside out. And I felt like I was trying to breathe through a straw while a gorilla was sitting on my chest. My PSA was 769. I lost my memory. My memory was gone. I could not remember I have 10 grandchildren. I could not remember their names, not all of them. I forgot which side of my car the gas tank was on. I had to use GPS to go to the supermarket right here in town.
Okay,
And,
man, can I ask you a question? I'm sorry,
yes, sir.
interrupted. You had this advanced stage prostate cancer. Were
Yes.
any clinical trials in the United States?
There were no clinical trials in the United States at that time. And so there were no clinical trials. So that's why I found out about something in Austria, and that's when I went to Austria to get the treatment. But
What was the treatment?
it was radioligand therapy. I got it there, and it was nuclear medicine, and it just totally changed my life. I was in rough shape when I went to Austria. I couldn't walk, but about 50 feet at a time. I couldn't get myself out of bed by myself. My wife had to get me out of bed. I couldn't. She would have to get me out of bed, put me on the toilet, clean me up, put me back in the bed. I was in rough shape. I couldn't go upstairs by myself. My wife had to grab my legs and lift each leg to go upstairs. I was in such bad shape. I couldn't get out of bed. I couldn't get into bed. I slept with my arms across my chest like this because I had so many tumors in my shoulders. If I didn't put my arms across my chest, it would the pain would be unbelievable.
So you were written off almost, I hate to say it like that, if in the United States because there wasn't any clinical trials that are available.
There was nothing.
And so then you had to go to Austria.
Mm-hmm.
What did you receive what was the treatment that you received in Austria?
The treatment I got in Austria was actinium. It was nuclear medicine or radioligand therapy. It was administered just like they were doing like they did the chemotherapy in the United States, but it was not chemo. It was the actinium, actinium and prednisone. And the two of them together was an amazing combo, because when I got there, I could only walk 50 to 100 feet at a time. So after the first treatment, I was able to walk 2 miles a day. The next day, I was able to walk 2 miles. The second week, I was walking 4 miles. And the third week, I was up to 10 miles.
And that's when you send me that text?
That's when I sent that text.
So knowing that you're now walking more than a couple of miles,
Mm-hmm.
Where are you today?
Okay, well, right now I'm my doctor in Austria. He said, Chuck, I give you the green light to go ahead and go back to playing basketball again. So I found a 30 and over league to be a part of. And when I joined the league, I was terrible, but over time I've gotten better. And in December, I was MVP again. I I missed my first shot and hit 12 straight after that.
So you were always MVP because you had all them grandchildren and children around you. But
Exactly.
we'll give you that. What I wanted to do is while in our last couple of minutes, I wanted you to take a minute or take some time, a minute,
Mm-hmm.
just tell the audience, what would you want the audience to walk away with about, because we talking about faith here, and
Yes.
caregiver that was,
Mm-hmm.
I mean, your wife, I mean, you like 300 pounds or something like that?
Yeah, I was like 310 pounds when I got sick.
When you were sick. And then she was there for you, and how important the caregiver was there. And then also, what do you want people to know about this is their chance to participate in a clinical trial, in clinical trials in the United States, where you had to leave the country to get
Right.
treatment to be alive.
Absolutely. I had to leave and pay out of pocket in order to do this. So if anybody has an opportunity to do a clinical trial with actinium, please, please, please do it. It's a game changer. It saved my life. I'm doing things now that I never thought I would be able to do. Like I say, I'm riding my bike every day, 35 miles a day. I'm active. I'm not stuck in the bed anymore. I felt hopeless. I felt hopeless. I felt like, first of all, I said, Lord, why me? And then, but then I realized that God was going to use this thing to help get the word out that there are other options. So once I realized that, that's when it all came together, and I felt so much better, so much better.
So Chuck, thank you. I want you to the audience to give Chuck a round of applause, some hearts, some claps, some high fives, because it takes a lot of courage to open up the kimono and convey your vulnerability and your weakness.
Mm-hmm. Mm-hmm.
It's very important, and the fact that one of the single points of that I remember was the day you said, "I'm going to fight this."
Mm-hmm.
Told me that.
Yes.
Grandchildren, so I want to hug my grandchildren, and now you're hugging. Matter of fact, you're not hugging them; they jumping on your back.
Exactly. Exactly. And I'm playing ball with them every chance I get. So I'm having a great time with my kids and my grandkids, and because I got 10 of them, almost 11. So I'm gonna enjoy them.
Yeah, you need to be healthy. You got all health experience. Mr. Womack, I said, I'm giving you a minute. What is the message you want our audience to have? And yes, I want to know, what message would you want the audience to have about clinical trials?
Yes, I do. I do think clinical trial is very important. I'm gonna go with scripture. It says, "My people will perish through lack of knowledge."
Hosea 4:6.
Thank you, thank you. And if we have doctors out there that don't know how to treat us, how else are we going to be treated? So I think clinical trial is best for us to get involved, so we can know how to be treated and what's best medicine for us. I never forget my doctor told me. He said that that the Zytiga for 15 years. He said that you had better results than anybody I ever seen. He said, and it works better for Black men. So those type of things we need to know when getting treatment and what works best for us. So that is my take. Yes, clinical trials are very important, and everybody who have a chance to get involved with it, please do so. Thank you.
Okay, I want the audience, I'm going to transition over to Tom. Tom's going to take control, but I want the audience to give these two men a hugs, high fives, loves, hearts, for taking the time to share their stories and being vulnerable with everyone to inspire other men to participate in clinical trials. Thank you.